Hi, welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of KevinMD. Today on the show, we have Shady Henien. He just finished his interventional cardiology fellowship and he wrote the KevinMD article, "This is a time for national unity, not sensationalism." Shady, welcome to the show.
Kevin, thank you for having me. It's great to see you again.
So we're going to get into your article in a bit, but first off, tell me your story and your journey to where you are today.
It's been a wonderful ride so far. I grew up in Easton, Pennsylvania, a wonderful family. I went to Wilson Area High School, played football there, was student body president. Then I had the wonderful opportunity to go to the University of Pittsburgh, where I studied in neuroscience and political science. I was also student body president out there. And then went to medical school at the University of Iowa, where I was student body president and learned a lot about, obviously, what I'm going to do with the rest of my life. Decided that I wanted to be a cardiologist, so went down the internal medicine route. That took me out to Connecticut, where I went to Yale at Bridgeport Hospital, where I did my internal medicine training. At that time, I learned a lot about myself and about leadership and about different areas that I would love to focus on moving forward in my professional life. At that time, I had the opportunity to join the American Medical Association. I ran for a national position. I was humbled to be selected by my peers to be the national chairman for the AMA resident and fellow section, which I had the opportunity to meet you many years ago, and also to work with residents and fellows from around the country. From there, I transitioned off and I went to my fellowship. I went to fellowship at Brown University in Providence, Rhode Island, where I did my cardiology training. And then I decided to stay on another year and did my interventional cardiology fellowship at Brown, which I just completed a few days ago. So it brings me here today, and I'm just so humble to and all the people who have helped me along the way. During this time period, I also realized that in order to do the kind of things that I want to do in healthcare policy, as well as streamlining healthcare to make it more affordable for patients, I needed an MBA. I was so fortunate by my program directors to give me the opportunity. I applied to a number of MBA programs, was accepted to Cornell University, which I graduated with their MBA just a month ago. That was a phenomenal ride, met so many wonderful people from around the country, especially in the New York area. And so now I'm on my beginning of my career so far. I'm going out to Illinois this next week for one more year of training if graduation wasn't enough, for structural cardiology training in Springfield, Illinois. During this ride, I met a lot of amazing people. I started a company with a couple of my classmates. It's called Physician Promise. I'm the CEO, and to date, so we've incorporated in March. We're going to be live later this summer. And it's a telemedicine platform to help patients that are suffering from very sensitive medical topics. We're the only telemedicine platform out there right now that's focused on couples' health. So if you can imagine the patients that we see on a regular basis, a lot of these sensitive topics, whether it be erectile dysfunction, hypoactive sexual desire disorder, premenopause, skin issues, hair loss issues, things that they don't want to readily talk about, especially with their loved ones, but especially with the doctor. This is an opportunity for them to come as a couple to learn more about their disease states, how they can help with one another, and then get the care that they need from one of our physicians at Physician Promise. We've also have everything's going to be done on the site where the medications will be prescribed there. It will be sent to one of our pharmacy partners. It will be filled there and be mailed to the patient.
So there's a lot to unpack there. Obviously, a very busy journey thus far. So we'll get into that in a bit. So first off, let's talk about how the pandemic has affected you from a cardiology standpoint. You mentioned you just finished your interventional cardiology fellowship. How has the pandemic affected you and your practice over the last few months?
Sure. Ever since this became a national issue, obviously a worldwide issue, we knew about it since the winter time. But really, America and our hospital started taking a lot of extra steps. I would say probably around January, February time. And how it's affected me is obviously as a cardiologist, interventional cardiologist, I didn't expect to see that COVID would be affecting a lot of these patients. But as you can see in the literature and the published reports that have been out so far, that there are patients who present with acute coronary syndrome and actually have normal coronary arteries. So now we're learning that the coronavirus is also causing a vasculitic process, which is so surprising to me, and I think surprising to a lot of interventional cardiologists. And I give my hats off to all the first responders, the frontliners, the nurses, the staff, EMS, the police, the firefighters, everybody who's helping our communities to get our patients the care that they need. Other than that, we see that our patients are nervous about coming to hospitals because they don't want to contract, obviously, the coronavirus, which is completely understandable. So now what's happening is that a lot of patients are becoming understanding of what telemedicine can do for them. And so now what we're seeing is a big shift. And now we had the early adopters of telemedicine a few years ago, but we've crossed that chasm. Now the entire country knows about telemedicine, and digital health is the future of care for things that are not as, obviously that having to put a stent, you'd have to come to the hospital, but for things that could be followed up on, or making new diagnoses through questionnaires or physical exams through Zoom. This is making healthcare a lot more readily accessible to patients, especially thinking about the rural areas. These are people who have difficulty getting to a tertiary care center, or let alone to a PCP's office. As long as they have Wi-Fi, they'll be able to get the care that they need. But otherwise, from a cardiology perspective, it's really showed me how to work as a team, both with our internal medicine colleagues, work with the nurses and the staff, administration, as well as the local government. I think everyone's doing their part. And as long as everybody just wears their masks, stays home if they don't have to go out, we'll get the recovery very soon.
And from a cardiology standpoint, is this something that you know now that you wish you knew back before the pandemic started?
Oh, absolutely. Yeah. Nobody knew that this was going to be such a big deal regarding for the coronary. We did a case a few months ago. There was a patient who had COVID, came in with a STEMI, and of course he had coronary disease, but he also had a lot of ectasia, so big openings or big widening in his arteries. Now, who knows? Potentially he could have been born with that. This could have been hereditary, but also it could have been caused by corona. We'll never really know about that. And from the published reports nationwide, we didn't know that this is going to cause such a big acute process. And the manner of death is VFib, and which is surprising to me. I thought it would just be more of a respiratory compromise.
So let's get on to your KevinMD article. You wrote this back in March, and it's titled, "This is a time for national unity, not sensationalism." And I want to read an excerpt from your article. You write, "Recent articles have accused some physicians of hoarding medications for themselves during our international medical crisis. Authors such as these should be ashamed of their coverage and wasted ability on sensationalism when they could be spending their time informing the public about the dangers of COVID-19 and the actions communities, hospitals, physicians, businesses, and public servants are taking on a daily basis to protect our great nation and the world from the perils of this invisible enemy." Now, those are fighting words. Tell me the story behind that article and why you decided to write it.
Kevin, I was outraged, and that's just to say it at the least, to see that the authors are wasting their skill and their reach to write such sensational articles about physicians and accusing physicians of using their knowledge, their access to medications for self-gain. That was absurd. Physicians, nurses, EMS, all the first responders are risking their lives every single day for Americans, as well as all patients that arrive in the emergency room, in the offices, in clinics across this country. And to have authors from the New York Times and ProPublica publish such outlandish articles accusing physicians of hoarding medications in a time of crisis where physicians are dying, nurses are dying, first responders are dying because of coronavirus. And for them to publish an article of such outlandish language and to paint such a negative portrayal of what physicians are doing in their communities, that really hit home. And, a lot of times I think as physicians, we sit back, we see all this nonsense that's being written about our colleagues or about our care or about the care that's occurring in the country or about how the healthcare system is running. But enough is enough. I'm seeing my own friends who are getting severely ill nationwide from coronavirus, who are physicians. And I'm not going to be able to sit back and let these authors write such outlandish articles. Potentially, maybe you may have 1 or 2 or 20 physicians who may have ordered themselves some hydroxychloroquine. We know very well today that, and even back then, there was no randomized control evidence that hydroxychloroquine is going to cure coronavirus. And now that we know today for sure hydroxychloroquine does not cure it, So for these authors to go out and not give any citations, not to give any names, not to give any, really, there's no credibility behind this article. And for them to just paint a picture that all physicians, that's how it came out, all physicians were hoarding these medications, or at least the majority of physicians are doing that. How does that paint a picture to our communities nationwide? Now, do they start to double think about what physicians are doing, what their ulterior motives are, when in fact, these physicians, you and I and our colleagues around the country, some of us are unable to go home because we don't want to get our loved ones sick. What's happening? They're staying in the hospital for extended periods of time. I know some nurses who are stuck in hotels because they don't want to go home and get their loved ones sick. And they're doing these 1 week stints on and off so that they don't affect anybody. Tell me, what other profession is doing something like this? So instead of applauding and thanking the first responders, the physicians, the nurses, the EMS, the police officers, the firefighters, everybody who's involved in this, also the local government officials who are helping hospitals have a good infrastructure so that they can deliver the care that they need to patients. They publish an outlandish article like this in two very, I thought, were reputable sources. Now I've lost a lot of respect, especially for those authors and for the publications themselves.
So those of us in healthcare, we don't have a lot of media training. Like, we're not trained to respond back in media in kind. So what do you suggest that the medical profession do whenever we feel that there's an article written about us that's unfair?
Kevin, I think you are a perfect resource of that. You are a wonderful mentor for that. The work that you've done in KevinMD has been phenomenal. It's really an inspiration to all of us as to how we can use our skill sets to educate our population, to educate our communities about what it means to be a physician and how to live a healthy life. So applauds to you, 100%. And when I met you many years ago, I was very inspired by what you've told us and how you use digital media and used being an author to your congruent with your profession. Now, how do the rest of us do this? Just speak your heart. We're physicians. We have spent so many years in training. Think about all the exams we've taken. Think about all the papers we've written in the past. To tell me that a physician is unable to write an article is very silly. So I think, as any physician out there, if you see something that's rubbed you the wrong way, please pick up the phone, call your local editor, whether it be you, Kevin, or a local radio host or a TV station, and let people know. People need the truth. When they're reading these articles that are being unopposed, unanswered for, that's it. The communities are going to start losing trust. The moral fabric of what healthcare is meant to have done back since Socrates' era and the Hippocratic Oath and all that stuff way back then is starting to erode because you have these type of authors that are going unopposed and unanswered. So now it's the time for physicians to really unite with one another, to educate their patients. We're not here to help these newspaper articles make sure that they get their ads and get their money by sensationalism. We're here to preach the truth to our patients, to help them get the care that they need, to get the access to care that they need, and also to give them the advice that's necessary so that they can live healthy lives. So in sum, if you see something, just write that article first. That's number one. Make sure that the article is written, and then start sending it off to a whole bunch of editors. You're going to get denied from some, but who cares? You will find one newspaper source that will say, I would love to publish this piece. And then from there, you start building credibility with that newspaper source, and you'll start to get a following on social media, and it'll be easier for you to start getting these articles published because people will then begin to trust what you're writing.
Well, thank you for sharing that inspiring advice. And I think one resource that I found particularly helpful was the OpEd Project. So if you just Google that, has a list of opinion sources that you could reach out and contact, share your story, and really get the word out from our perspective out there. I normally ask my guests something that they're passionate or curious about, but I want to ask you something on a different tack, because earlier on you talked about your company, and I'm curious, you're so busy as an interventional cardiologist. What was the impetus for you to go ahead and get your MBA and be a CEO of a company?
Yeah, no, thank you, Kevin. So, I grew up, and I don't want to, boast or anything, but, I grew up and I've had such an amazing opportunity. I've been blessed with so many different skill sets, and I didn't want them to go away. And I thought to myself, all right, I've been blessed. I had a wonderful training in medicine. Now, how can I use these other things, such as leadership, public speaking, decision making. How can I bring these all together? And so that I know I have the raw tools, but how do I make something of it? And I thought MBA was the best way to go about it. So the MBA helped me to take the raw tools that I had and put them into different frameworks so that they can become effective and add value to others. So the things that I've worked on in the past that I told you about, it all came to fruition. And now with the business training and the medical training, I'm able to streamline a lot of different things to add value both to physicians as well as to patients. Take out a lot of the different middlemen that add a lot of that pork into healthcare that makes it very expensive. It's not the physicians that are making healthcare expensive. You can look up any of these articles. There's plenty of articles published about this, but it's the added roles in healthcare, and I'll just leave it at that are unnecessary to be there. So remove them.
Thank you so much for sharing that. We're talking to Shady Henien. He just finished his interventional cardiology fellowship. He wrote the KevinMD article. This is a time for national unity, not sensationalism. Shady, what is your take-home message as it relates to the article to the KevinMD audience?
Great, thank you, Kevin. As physicians, we work very hard since, I would say, probably since high school. Nobody just wakes up and says, I'm going to be a doctor tomorrow. You needed to have committed your life to education, to learning, to dedicating your time and your energy and your thoughts on how to become a physician. This is a time where America needs physician leadership, where they are getting so many sources of information from a lot of different media outlets. Some of them are fake, some of them are okay, some of them are evidence-based, and some of them are just, not even worth listening to. So as physicians, we have that knowledge. We were gifted and we were trusted by our communities and our country to care for them. This is our opportunity now to help our patients better understand how they can get the care that they need and also to be safe. Because America was not built to be inside of our basements or inside of our rooms. America was built for commerce, for enjoying life and vibrant and celebrations and graduations and prom and sports. And we're all going to get back there again. But I think we need more physician leadership to help educate everybody about what to do, as well as to help our local as well as federal elected officials on how to make decisions regarding healthcare.
Well, thank you so much for your time and insight. How can people reach you?
They can reach me in multiple ways. I'm on Facebook. My email is shady_henien@physicianpromise.com. That's SHADY_HENIEN@physicianpromise.com. They can also go to our website, physicianpromise.com, and start to interact with us and send whatever notes. They can join our mailer list. Those would probably be the easiest ways for now.
Fantastic. Thank you for joining me on the show.
Thank you, Kevin. All the best to you.